Victor Ashford slammed his hand against the nurse's station counter so hard that every head in the emergency room snapped up. "You're done," he said loud enough for every doctor, nurse, and patient in that hallway to hear. "Pack your things. Security will escort you out." He didn't lower his voice. He didn't flinch. He pointed his finger directly at Maya Reeves, the woman who had just pulled a dying man back from the edge of death with her bare hands, and he smiled. Not the smile of a man who felt bad about what he was doing. The smile of a man who had been waiting for this moment for a long time. If this story moves you, please subscribe to our channel, hit that notification bell, and drop a comment with the city you're watching from. I want to see how far this story travels. Now let's go back to the beginning because you need to understand exactly what kind of woman Victor Ashford just made the mistake of destroying. The emergency department of Harbor Heights Medical Center had seen 100 nights like this one. Cold outside, brutal. Inside, the kind of night where the ambulance bay doors never stopped swinging. Maya Reeves had been on her feet for 11 hours straight. Her surgical gloves had been changed 4 times. She had eaten half a protein bar standing over a sink at around 7 in the evening, and she had forgotten about it 10 minutes later when a motorcycle accident came through the doors and demanded every cell of her attention. That was the job. That was always the job. She had never once complained about it. She was 41 years old. She had spent 15 of those years becoming exactly the kind of surgeon Harbor Heights claimed it wanted, the kind who stayed late, who showed up early, who took the cases nobody else wanted and turned them into survivable outcomes when the statistics said they shouldn't be. She had trained at Johns Hopkins. She had done her residency at a level 1 trauma center in Baltimore, where gunshot wounds and car crashes came in back to back, and you either learned to work fast or you went home. She had chosen to work fast. She had chosen to stay. Harbor Heights was supposed to be different, a prestigious private hospital on the edge of the city, the kind of place with marble in the lobby and a donor wall 3 floors high. Maya had taken the position 6 years ago because they told her she would have resources, state-of-the-art equipment, a surgical team she could actually trust. What they didn't tell her, what they never tell you she had learned, was that resources at a place like Harbor Heights came with strings attached. Long strings. Strings that led directly to Victor Ashford's office on the 14th floor. She didn't think about any of that when the call came in at 9:47 in the evening. She was already gloved and moving before the paramedics finished their handoff. John Doe male, approximate age, mid-30s, found unconscious under the Route 9 overpass, blunt force trauma to the chest and abdomen, laceration to the left temporal region, B, P60 overpalp, heart rate 142. We almost lost him twice on the way in. Maya looked at the man on the gurney and felt the familiar weight of the calculation every trauma surgeon runs in the first 3 seconds. She didn't see a vagrant. She didn't see dirty clothes or matted hair or a face that hadn't seen a razor in weeks. She saw airways, she saw circulation, she saw a chest that was rising wrong on the left side, and she made her call before the gurney cleared the bay doors. "Get me a chest tube tray. Now, someone call respiratory. I need a portable ultrasound at this bay in 90 seconds. Her resident, a sharp young woman named Dr. Priya Nair, was already at her elbow. "Maya, we've got Dr. Calloway's patient still in bay 3, and the family is asking about the timeline. They're connected to the board." "Then someone go talk to the family," Maya said, not stopping, not looking up. "Because right now I have a hemopneumothorax that's going to kill this man in the next 4 minutes if I don't decompress that chest." "Yes, Dr. Reeves." She worked. That was what Maya Reeves did. She worked the way some people pray, with her whole body in it, with a certainty that had nothing to do with arrogance and everything to do with the years and years of seeing what happened when someone hesitated. The chest tube went in. The blood that had been compressing the man's lung drained, and the left side of his chest finally began to move the way it was supposed to. His oxygen saturation climbed from 82 to 94. His heart rate came down. Still not good, but alive. "He's got internal bleeding," Maya said, reading the ultrasound herself. "Free fluid in Morrison's pouch, significant. He needs the OR. "Dr. Reeves." The voice behind her was not Priya's. She didn't turn around. She was mid-assessment. "Not now." "Dr. Reeves?" The voice got louder and she recognized it the way you recognize the sound of approaching thunder. Something in your body knows before your mind catches up. She turned. Richard Holt, the hospital's chief operating officer, was standing at the edge of the bay. He was a man built for board meetings and difficult conversations, with a carefully neutral expression that he had clearly practiced in a mirror. Behind him stood 2 nurses who looked like they wanted to be anywhere else in the world. "Dr. Reeves, Dr. Ashford needs to speak with you. Now." "Mr. Holt, I have an unstable patient going to the OR in approximately 3 minutes. Whatever Victor needs can wait." He said it cannot. She looked at Holt for exactly 1 second. Then she looked back at her patient. "Get me OR2. Call Dr. Tanaka and tell him I need him to open. I'll be there in 4 minutes." She stripped one glove off and turned to face Holt fully. "You have 60 seconds. Holt glanced at the nurses. In private. These are my staff. Talk. He didn't like that. She could see it in the way his jaw tightened. Mr. Calloway in Bay 3 was waiting for your evaluation. He is a major donor to this hospital. Mr. Ashford expected him to be your priority this evening. Mr. Calloway in Bay 3 has a stable kidney stone and a very low pain tolerance, Maya said. He was evaluated. He's been given appropriate pain management. He is not in danger. This man is. Dr. Reeves, is there a medical question you would like to ask me, Mr. Holt? Because if not, I have a surgery to perform. She didn't wait for his answer. She walked. The surgery took 2 hours and 14 minutes. The John Doe had a splenic laceration, a liver contusion, and 2 broken ribs that had done damage on their way to wherever they had landed. Maya repaired what could be repaired, controlled the bleeding, and watched the monitors until every number on every screen told her the same thing: he was going to make it. Not because he was lucky, because she had refused to walk away. She was pulling off her surgical cap in the scrub sink hallway when Priya appeared at her side, and the look on the younger doctor's face told Maya everything before a word was spoken. He's waiting for you in the consult room, Priya said quietly. Ashford, he came down himself. Of course he did. Maya, Priya touched her arm. He's got HR with him. The consult room on the surgical floor was small and carpeted and had a window that looked out on the parking structure. Victor Ashford was standing when Maya walked in, which she recognized immediately as a power choice. He was 63 years old, silver-haired, the kind of man who had gone directly from business school to administration without ever spending a day in clinical medicine. And he wore his authority the way some men wore cologne. Too much of it applied with confidence, offensive to anyone who got too close. The HR director, a woman named Sandra Cole, who had always been perfectly civil to Maya in the hallway, sat at the table with the folder open in front of her and did not make eye contact. Dr. Reeves, Ashford said. Sit down. I'll stand, thank you. Something moved across his face. Not anger exactly, satisfaction. Like she had given him the first move in a game he had already decided he was going to win. I've been hearing about your performance this evening. Good, I saved a man's life. You abandoned a priority patient. I stabilized Mr. Calloway and then I treated a critical trauma. That is not abandonment, that is triage. Mr. Calloway is a donor. He gives this hospital $400,000 a year, Maya. $400,000. Do you understand what that kind of money funds? Do you understand how many programs, how many staff positions, how many pieces of equipment exist in this building because men like Gerald Calloway write checks? I understand it very well, Maya said, and I understand that none of it matters to the man I just spent 2 hours keeping alive on that table. He's a vagrant, Ashford said. The word landed flat and hard like something thrown. He is an uninsured John Doe who will cost this hospital money we cannot recover. And you deprioritized a major donor to treat him. This is not the first time you have made choices that put this hospital in a difficult position. No, Maya agreed, it's not. Because every time the difficult position is between doing the right thing and doing the profitable thing, I choose the right thing. That's actually what a doctor is supposed to do. Sandra. Ashford said it without looking away from Maya. Sandra Cole opened the folder. She cleared her throat. She still did not look up. Dr. Reeves, effective immediately, Harbor Heights Medical Center is terminating your employment. You will be compensated through the end of the pay period. You are asked to surrender your hospital ID and any access credentials before leaving the building tonight. The room went very quiet. Maya heard that silence in a way she had not expected. She had known this was possible. She had known it was coming, maybe in the abstract way, you know a storm is on the way, but still feel surprised when the first crack of lightning splits the sky directly above your head. She had saved that man. She had done everything right. And Victor Ashford was standing in a carpeted room, firing her for it. You should reconsider this, she said. Her voice was steady. She was proud of that. The decision has been made. I will file a complaint with the state medical board. What you're describing, retaliating against a physician for exercising clinical judgment in a life or death situation, that is a serious ethics violation. Ashford smiled. It was not a warm smile. File whatever you like. This hospital has a legal team that has handled far more significant complaints than yours. He took one step toward the door, a dismissal. Security will meet you at your locker. They will escort you out. Victor. She used his first name deliberately, and she watched him dislike it. That man on the table tonight, the one you just called a vagrant, he might have died. And you would have let him die because he didn't have a donor card in his wallet. That's not what happened. That's exactly what happened, and you know it. He opened the door. He gestured toward the hallway with one hand, an almost theatrical motion like a maitre d' directing someone to a lesser table. Goodbye, Dr. Reeves. She walked out of that room with her chin level and her hands at her sides, and her heart slamming against her ribs in a way she refused to show on her face. She walked past Priya, who was standing just outside the door and who looked like she had aged 5 years in the last 10 minutes. She walked past two nurses who had clearly heard everything and who stood very still the way people stand when they're witnessing something they don't know how to stop. She walked to her locker, she changed her shoes, she put her stethoscope in her bag, and she did not say a single thing that she would regret. The security guard who walked her to the exit was a man named Bert, who had known Maya for 6 years and who said nothing the entire way because there was nothing to say, and who looked, if she had to describe it, ashamed. Not of her, of what he had been asked to do. The main lobby of Harbor Heights Medical Center was not empty at that hour. There were families in the waiting area. There was a woman at the information desk. There were people who looked up when the sound of heels crossed the marble floor with the particular rhythm of someone being walked out, and who understood without being told exactly what they were seeing. Maya Reeves kept her eyes straight ahead. She pushed through the revolving door. Outside, the cold hit her like a hand pressed flat against her chest. She stopped on the sidewalk. She breathed. The city moved around her, a taxi, a cyclist, the distant sound of a siren that might have been one of her cases coming in, and she stood in the middle of it and felt for just a moment completely unmoored. She had dedicated 15 years to this. She had given up weekends and sleep and relationships that couldn't survive the schedule she kept. She had stayed late when she could have gone home and gone in early when no one asked her to, and turned down offers from other hospitals because Harbor Heights, she had genuinely believed, was a place that cared about the work. She pulled out her phone. Her hands were steady. She looked at the screen without really seeing it. Then she put it back in her bag and started walking toward the parking garage because standing still was not something Maya Reeves was built for. She was halfway across the garage when her phone rang. She didn't recognize the number. Area code she didn't know immediately. She almost didn't answer. She was exhausted and hollowed out, and she had about 15 minutes of composure left in her before she got in her car and let herself feel the full weight of what had just happened. But some reflex built from years of being on call, of knowing that an unknown number in the middle of the night was never nothing, made her pick up. Dr. Reeves? The voice on the other end was male-controlled and carried the particular texture of authority that doesn't need to announce itself. My name is Major Garrett Stone, United States Army Special Forces. I need to speak with you about a patient you treated tonight. She stopped walking. Who gave you this number? We have resources, doctor. I apologize for the intrusion. I need to know the current status of the John Doe admitted to Harbor Heights approximately 3 hours ago. Male, mid-30s, found near the Route 9 overpass. Her hand tightened on the phone. I can't discuss patient information with... His name is Daniel Stone, the voice said. He is my brother, and he is not who Harbor Heights thinks he is. She stood between two parked cars in a concrete garage and felt the night shift around her in a way she couldn't entirely describe. What do you mean? I mean that Daniel was on an active operation that went wrong 10 days ago. We were told he was dead. I need to know if he's alive, Dr. Reeves. Right now in this moment, that is the only thing I need to know. She had spent 2 hours keeping him alive. She had watched his numbers stabilize and his pressure hold and his color come back from the gray-white of near death to something approaching human. She had stood over him at the close of the surgery and thought, without quite knowing why, that there was something about him, something in the structure of his face, in the particular stillness of his hands, even under anesthesia, that felt like a man who had been through things she couldn't imagine. He's alive, she said. He came through surgery. He's in recovery. She heard something on the other end of the line that might have been a breath released long, controlled the breath of a man who had been holding it for longer than just this phone call. Is he stable? His vitals are holding. He had significant internal bleeding and 2 broken ribs that caused secondary damage. He's going to need careful monitoring for the next 12 to 24 hours. She stopped. She thought about what she had seen on that table and about the things that had not made sense to her in the moment and that she had filed away because there had been no time to examine them. There are some findings that I didn't have time to fully evaluate. What kind of findings? Major Stone, I don't have hospital access anymore as of about 40 minutes ago. I was terminated tonight. Silence. Then terminated. Yes. For treating my brother. She hadn't put it together in quite those terms before that exact moment. She stood in the parking garage and let it settle over her. Apparently, he wasn't the right kind of patient. Another silence. Longer this time. When Garrett Stone spoke again, something in his voice had changed, not louder, not angrier, but harder. The way metal sounds different when it's been heated and cooled. Dr. Reeves, I need you to listen to me very carefully. My brother was not the victim of a random assault. He was poisoned. We believe it happened before the explosion, that we were told killed him, and we believe the toxin is still active in his system. The symptoms, the trajectory of his presentation, they will not follow a standard trauma pattern. Whatever your team is monitoring him for tonight may not be the right things. The cold in the garage had nothing to do with the temperature. What toxin? She asked. Her voice came out professionally flat. The part of her brain that was still a surgeon, still entirely a surgeon, had taken over. We don't have confirmation yet. We have a working theory. I have a military medical officer with me, but Dr. Reeves, he is not a trauma surgeon. And what Daniel went through tonight before you got to him, he needs someone who has seen the inside of a chest like that and knows what she's looking at. I'm not employed by that hospital anymore. I know that, Garrett Stone said. I'm not asking you to go back to Harbor Heights. I'm asking you to meet me now, because in the next few hours, my brother's situation is going to become significantly more complicated, and there is a strong possibility that the people who poisoned him are not finished. She was quiet for a moment. The city hummed beyond the concrete walls. Somewhere a car door slammed. Somewhere a siren wailed and faded. Where, she said, there's a diner on Merchant Street. The Bluebird. Can you be there in 20 minutes? She looked at her car. She looked at her bag. She thought about the man on the table, Daniel Stone. His name was Daniel Stone, a Navy SEAL who was supposed to be dead. And she thought about the things she had noticed during surgery, that she hadn't had time to analyze that odd discoloration at the tissue margins that she had attributed to the trauma, but that had nagged at her in some quiet back corner of her mind through the final 30 minutes of the procedure. Wabimi 15, she said. She was in her car and pulling out of the garage before the thought fully crystallized, before she let herself acknowledge what she already suspected. The discoloration, the unusual presentation of the bleeding, the way his body had fought the anesthesia with a resistance she had not seen before. She had chalked it up to the stress of whatever life this man lived. But if Garrett Stone was right, if there was a toxin, if someone had deliberately introduced something into Daniel Stone's system before whatever explosion had put him under that bridge, she gripped the steering wheel. She drove. What she didn't know, what she couldn't know, as she moved through the night toward a diner on Merchant Street, toward a man she had never met, who was asking her to step back into the middle of something she didn't yet understand, was that Victor Ashford at that exact moment was receiving a phone call of his own. A call from a number he recognized. A caller whose name he would never say aloud in front of witnesses. A caller who said in a very quiet voice that the John Doe who had come through Harbor Heights that evening needed to be removed from the hospital's records entirely. No paperwork, no trail, no evidence that he had ever been there. And Victor Ashford, who had spent his entire career making problems disappear for people with enough money to make disappearing worth his while, said yes. He should have thought about what Maya Reeves knew. He should have thought about what she had seen. He should have thought for just one moment about the fact that the woman he had just fired was not the kind of woman who went quietly home and waited for someone else to fix things. He didn't. That was his second mistake. His first had been underestimating her in the first place. The Bluebird Diner on Merchant Street was the kind of place that never fully closed. Always a pot of coffee going, always a handful of people who had nowhere better to be at that hour. Maya pushed through the glass door and felt the warmth of the place hit her face and did a quick sweep of the room the way she had learned to do in trauma bays. Who's here? Who matters? What's wrong? She found him immediately. He was sitting in the back booth, not against the wall the way most people sit, but angled so he could see both the door and the kitchen exit at the same time. That told her something. He was in civilian clothes, dark jacket, no insignia, but he sat the way military men sit, like the body never fully stands down even when the mind tries to. He was probably 45, broad-shouldered, with a jaw that looked like it had been used for things jaws weren't designed for, and dark eyes that tracked her from the moment she stepped inside. Across from him sat a younger man in a similar jacket, a tablet open on the table between them. Garrett Stone stood when she reached the booth. He didn't extend his hand immediately. He looked at her the way she imagined he looked at intelligence reports, thoroughly quickly reaching a conclusion. Dr. Reeves, he said, Major Stone. Sit down, please. She sat. The younger man across from her had the kind of focus that made him look older than he probably was. Garrett didn't introduce him, which she noted and filed. How long does Daniel have? Garrett asked. No preamble, no small talk. She appreciated that. In terms of the surgical repair, if there are no complications, he should be through the worst of it by morning. The concern isn't what I fixed. The concern is what I couldn't identify. She leaned forward. Tell me about the toxin. Garrett exchanged a look with the younger man. Then he made a decision. She could see it happen in real time, the way the muscles around his eyes shifted, the way he settled his weight differently. 12 days ago, Daniel was embedded in an operation I can't fully brief you on. What I can tell you is that 6 hours before the extraction was supposed to happen, his team lost contact with him. We received confirmation the next morning that there had been a detonation at the primary site. We were told he was KIA. But he wasn't. He wasn't, which means someone either made a mistake in the confirmation or someone wanted us to believe he was dead. Garrett's voice stayed level. That steadiness Maya was beginning to understand was not calm. It was the thing underneath calm, the thing that existed when a person had burned through every version of panic and arrived somewhere colder on the other side. 2 days ago, we received intelligence suggesting Daniel had been seen in the city, alive but compromised. We've been tracking the signal since yesterday evening. What do you mean by compromised? We believe he was administered a compound, likely a modified organophosphate derivative, before the explosion. Not enough to kill him outright, enough to degrade his system over time, enough to make him, Garrett paused for just a fraction of a second, manageable. Maya sat with that word for a moment, manageable. Someone had poisoned a Navy SEAL to make him manageable. Why, what does someone gain from keeping him alive and incapacitated? That's the question we're trying to answer, Garrett said. And that's why I need him in one piece and conscious, and why I need someone who has already looked inside his chest and knows what she's dealing with. His tissue presentation was abnormal, Maya said. I noticed it intraoperatively. There was discoloration at the margin of the splenic laceration that I attributed to the trauma, but it didn't sit right with me. The bleeding pattern was also unusual, slower than I would have expected for the degree of injury, almost like something was interfering with the normal coagulation cascade. Garrett's jaw tightened. He looked at the younger man. Hobbs. Hobbs, the younger man, turned the tablet around. On the screen was a medical document dense with technical language with several lines highlighted in yellow. The compound our analysts identified has a known effect on platelet aggregation, Hobbs said. It wouldn't prevent clotting entirely, but it would slow it significantly. And it has a secondary effect on the hepatic enzymes, the liver's ability to process and filter. In a patient who also sustained a liver contusion, the two would compound each other, Maya finished. She felt her mind accelerate in the way it did in surgery when all the information suddenly clicked into a pattern. His liver is already stressed from the contusion. If the toxin is metabolized hepatically, the damage to the tissue could be slowing its own clearance. He could be poisoning himself as his own body tries to recover. That is exactly what our medical officer told us 40 minutes ago, Garrett said. And he said that without direct intervention, the toxin levels in Daniel's blood will reach a threshold within the next 6 to 8 hours that could cause cardiac arrhythmia, potentially fatal. The coffee cup that a tired waitress had placed in front of Maya sat untouched. She looked at Garrett Stone and she understood with perfect clinical clarity that the man she had spent 2 hours saving was still dying, just more slowly, and the only people who knew it were sitting in a back booth of a diner on Merchant Street. He needs treatment now, she said. Yes. He's in recovery at Harbor Heights. I don't have access to that hospital anymore. And even if I did, she stopped. She thought about Victor Ashford's phone call, about the caller whose name he would never say in front of witnesses. She didn't know about that call yet. She didn't know that Daniel Stone's records were already being erased. But she felt it the way you feel a current in water before you can see it. There's something else, she said. Isn't there? Garrett looked at her for a long moment. We have reason to believe the people who poisoned Daniel have tracked him to Harbor Heights. The diner felt smaller suddenly. If they know he's there, then the recovery ward is not a safe location for him, which means we need to move him tonight. Moving a post-operative patient 6 hours out of major abdominal surgery is an enormous risk, Maya said, and she heard the surgeon in her own voice, fighting with something else, the part of her that had already done the math and knew that leaving him there might be a worse risk. If there's any internal bleeding that hasn't fully resolved, transport could... I know, Garrett said. I know what I'm asking. That's why I called you. Her phone buzzed on the table. She glanced at it. Priya. She picked it up immediately. Priya. Maya. Priya's voice was low and tight in a way that made the back of Maya's neck prickle. I need to tell you something, and I need you to listen without reacting, because I am standing 15 feet from Richard Holt right now, and I cannot look like I'm having this conversation. Go ahead. The John Doe, your patient, his records are being pulled from the system. I just watched Sandra from IT go into the database with an administrator override. His admission record, his surgical notes, his blood work, all of it. Someone is erasing him. Maya kept her face completely still. Across the table, Garrett watched her with those dark analytical eyes and read something in her expression because he leaned forward slightly. They're already moving, she said. What? Priya asked. Not you. Stay exactly where you are. Tell me, is he still in recovery? Right now. For the moment, but Maya, there are 2 men who came in through the administrative entrance about 20 minutes ago. They showed credentials to security. I don't know who they are, but they asked specifically about unidentified patients admitted through trauma in the last 4 hours. Maya looked at Garrett. We're out of time, she said, not to Priya, not to Garrett, specifically just to the room. Then to Priya. Does he have a monitor alarm? Is he wired to the central station? Yes, standard post-op monitoring. If that monitoring gets interrupted, if someone disconnects him from the central system, will there be an alert? A pause. There should be a disconnect alarm. But Maya, if someone with administrator credentials overrides the Priya. Maya kept her voice flat and steady. I need you to do something that is going to feel wrong. I need you to trust me anyway. Priya was quiet for exactly 3 seconds. Tell me what to do. What Maya told her took 90 seconds to explain and required Priya to make 2 phone calls of her own, one to the on-call charge nurse framed as a routine concern about post-op monitoring integrity, and one to Dr. Marcus Webb, the senior attending who had assisted Maya in the OR and who owed her by her count approximately 4 favors from the last calendar year. It was not a perfect plan. It was a plan made of available materials in the time she had, which was the only kind of plan Maya Reeves had ever been particularly good at. She hung up and looked at Garrett. Your brother is about to be moved within that hospital under the cover of a routine equipment check. That buys you approximately 30 minutes before anyone with bad intentions figures out he's not where they left him. Your medical officer, where is he right now? 40 minutes out. Not good enough. I need to get back into that building. You were just escorted out. I know. She stood up. She picked up her bag. I'm going to need your help with that part. Garrett Stone looked at her for a moment with an expression that was not quite surprise and not quite respect, something between the two. Something that looked like the rapid recalculation of an assessment he thought he had already completed. Then he stood up and Hobbs stood up, and all three of them moved toward the door. The plan to get Maya back into Harbor Heights was not elegant. Elegant took time, and time was the one thing they didn't have. What they had was Garrett Stone, who made 1 phone call from the passenger seat of Maya's car during the 12 minutes it took to drive back to the hospital, and whose phone call produced by the time they arrived at the service entrance on the east side of the building a laminated visitor credential and a security contact who had been stationed at that entrance for 11 years, and who, after a brief and very quiet conversation with Garrett that Maya was not privy to, stepped aside without a word. She went in. Garrett and Hobbs stayed outside, positioned in a way that looked casual and wasn't. The recovery ward was on the 3rd floor. Maya moved through the hospital with the confidence of someone who belonged there, which she had always found was the most effective camouflage available, not hiding, just being unremarkably present. She knew these hallways. She knew which nurses' stations faced which directions, which corners were covered by cameras, which stretches of corridor were reliably empty at this hour. She had worked here for 6 years. Victor Ashford had taken her badge. He had not taken her knowledge. She found Daniel Stone in the room that Priya had moved him to, a single-bed observation room at the end of the recovery corridor, ostensibly transferred for equipment, reasons that the charge nurse had logged dutifully and without asking too many questions. He was unconscious. He was pale, but not the chalky, terrifying pale of intra-operative crisis, more the pale of genuine exhaustion of a body that had been pushed past every limit it had and was now simply trying to remember how to rest. He was connected to a monitor. His heart rate was 71. His pressure was holding. She moved to his chart physical since Priya had correctly assumed that the electronic version was compromised and read through it quickly. His labs from the initial workup were there. She looked at the liver panel. She looked at the coagulation studies. And she felt the cold certainty of recognition settle into her bones because Hobbs had been right. The numbers were wrong in exactly the way they would be wrong if a modified organophosphate was cycling through his hepatic system and the liver trying to clear it was simultaneously too damaged to do the job efficiently. Okay, she murmured to herself, to Daniel Stone, to nobody. I see you. She was pulling out her phone to call Garrett when the door opened. She expected Priya. She expected Dr. Webb. She was not expecting Victor Ashford, who stood in the doorway of the recovery room with his silver hair and his custom suit and an expression that moved rapidly through surprise, fury, and the particular ugly satisfaction of a man who has just caught someone doing exactly what he hoped they would do. Dr. Reeves. His voice was very quiet. Quiet in the way that meant he had something he wanted to use. This is extraordinary. You were escorted off these premises 3 hours ago. Victor, I'm calling security. He already had his phone in his hand. That patient needs treatment, Maya said. She stepped between Ashford and the bed. Not dramatically, just cleanly, the way you step between something vulnerable and something dangerous. He's been poisoned, not injured, poisoned. His liver panel shows hepatic enzyme elevation consistent with an organophosphate derivative, and his coagulation studies are, he is a John Doe with no insurance and no record in this hospital system, Ashford said. He looked at her over his phone screen with eyes that were utterly devoid of anything she could reach. And you are a trespasser. Don't make that call, she said. I have already made considerably more consequential calls this evening, Maya. This one is the easy one. His thumb moved on the screen. The door opened again. Not Priya, not Dr. Webb. Garrett Stone walked into the recovery room of Harbor Heights Medical Center in the measured, unhurried way of a man who has never once in his adult life entered a room where he did not feel that he was in charge of what happened next. He was followed by Hobbs and by 2 other men who had materialized from somewhere and who had the same quality of contained authority, That Garrett carried the kind that came from years of operating in places where hesitation had consequences. None of them said anything. They didn't need to. Victor Ashford's thumb stopped moving. Garrett looked at Daniel, one long look, a brother's look, something so raw and unguarded that it lasted exactly 1 second before the professional mask came back down. Then he looked at Ashford. "Sir," he said, politely, almost pleasantly, "I'm going to need you to put that phone down." Ashford's voice came out slightly less steady than before. "This is my hospital. I have a document in my jacket." Garrett said that was authorized 45 minutes ago by a federal judge at the request of the Department of Defense, which designates this patient as a protected military asset and grants my team operational authority over his medical care and secure transfer. I also have in Hobbs's tablet a record of a phone call you received this evening from a number connected to a person of active federal interest. He let that sit in the air for exactly 3 seconds. "So when I say I need you to put the phone down, Mr. Ashford, I am not being dramatic. I am being precise." Ashford's phone went to his side. It was the first time Maya had ever seen Victor Ashford small. Not physically, he was still the same silver-haired man in the same expensive suit. But something went out of him in that moment, like air from a tire. And what was left was just a man standing in a recovery room at midnight, realizing that the ground he thought was solid was not. "There will be consequences for this," Ashford said. His voice had that last resort quality, the quality of someone who knows the threat is hollow and makes it anyway. "There will be consequences for a great many things tonight," Garrett agreed. He turned to Maya. "How long to stabilize him for transport?" "Give me 20 minutes, Maya said. She had already moved to the medication cabinet. She had already begun the calculation, what he needed, how much, what the risks were, what the protocol was for moving a post-operative poisoning case. She worked. That was what she did. She worked. Behind her, she heard Garrett speak to Ashford one more time. The words were quiet, and she was focused on her patient, and she only caught fragments: federal cooperation and legal counsel, and a name she didn't recognize that made Ashford go very still. She didn't stop working to listen. She would find out later. Right now, the only thing that mattered was the man on that bed and the numbers on that monitor and the 18 minutes she had before whatever calm they had bought in this room started to run out. Priya appeared at her elbow. She had at some point in the last few minutes begun to cry very quietly and had apparently decided that was not acceptable because she had also very clearly stopped and replaced it with the focused efficiency that made her an exceptional doctor. "Tell me what you need," Priya said. "Atropine on standby. I want a fresh line-wide bore. And I need the portable cardiac monitor from the charge desk, the one with the long-range transmitter." "On it." "Priya." Maya glanced at her for just a moment. "Thank you." "Don't thank me yet," Priya said. "Thank me when he's actually alive." Daniel Stone's monitor showed a heart rate of 68. Still holding. The first dose of the chelating agent Maya had calculated moved into his line, and she watched the numbers. The way she always watched numbers, not with hope, exactly, but with the focused attention of someone who believes that if you watch carefully enough, you will see what's coming in time to do something about it. She had been watching numbers her whole career. She had been right more times than she had any right to expect. She was going to be right this time too. She needed to be. Because somewhere in this city, the people who had poisoned Daniel Stone were already moving. And whatever they had planned for the rest of this night had not yet been canceled, just because a fired surgeon and a special forces major had found each other in a diner on Merchant Street and decided to be inconvenient. The monitor beeped steadily. Maya's hands moved. Victor Ashford stood very still near the door and said nothing because there was nothing left for him to say. Garrett Stone stood near his brother's bed and watched, and in his eyes was something that was not quite hope and not quite fear. Something that looked, if she had to name it, like faith. Faith in her specifically. In this woman he had spoken to for the first time 45 minutes ago and had somehow already decided was the right person to stand between his brother and whatever was coming next. She would not be the person who proved him wrong. They moved Daniel Stone out of Harbor Heights Medical Center at 12:47 in the morning through the service corridor on the east side of the building on a gurney that Hobbs had sourced from a supply room, with the quiet efficiency of a man who had clearly requisitioned things from less cooperative environments than a hospital storage closet. Maya walked alongside the gurney with her hand on Daniel's wrist, not because she needed to take his pulse manually when the portable monitor was doing it electronically, but because physical contact told her things that numbers sometimes didn't. She felt his pulse under her fingers irregular, in a way that worried her steadier than it had been 20 minutes ago, in a way that gave her just enough to hold on to. Garrett walked ahead. His two operators flanked the corridor. Hobbs had the tablet open, tracking something on the screen that he did not explain, and that nobody asked him to explain, because everyone in that corridor understood implicitly that the information on that screen was the reason they were moving quickly and quietly instead of not moving at all. Victor Ashford was still in the recovery room when they left. He had not tried to stop them. He had not made another call. He stood near the window with his phone in his hand and his authority entirely dissolved and said nothing as they wheeled his erased patient out of his hospital in the middle of the night. Maya did not look back at him. She had spent enough of this night looking at Victor Ashford. She was done. The vehicle waiting at the service entrance was not an ambulance. It was a large black SUV with federal plates and a rear compartment that had been modified with the kind of portable medical equipment that told Maya, without anyone needing to say it, that Garrett Stone had been planning for exactly this scenario before he ever called her. A man in his mid-50s with close-cropped gray hair and the bearing of someone who had spent decades making decisions in difficult places was waiting at the rear of the vehicle. He introduced himself as Captain Roy Mercer, military medical officer, and he looked at Maya with a particular evaluating expression of someone who had been briefed on her and was deciding in real time whether the brief was accurate. Dr. Reeves, Mercer said. Captain, she said, his liver panel is compromised, and I've initiated chelation, but we are going to need a proper lab within the next few hours to confirm the toxin and adjust the protocol. What's your working theory on the compound? Mercer blinked. He had apparently expected more preamble. He adjusted rapidly. She gave him credit for that. Modified VX derivative, not the standard agent, something that's been engineered to slow release over 72 to 96 hours. The initial dose would have been administered up to 10 days ago. Which means he's been fighting it the entire time he was under that bridge, Maya said. Not a question, a conclusion and an ugly one. Daniel Stone alone and compromised his own body being slowly dismantled by something someone had put inside him deliberately, while the people who should have been looking for him were told he was dead. That's our assessment, yes. Then the chelation I started is correct but insufficient. We need to support the hepatic pathway actively. What do you have on board? Mercer opened the rear compartment and they went to work side by side in the back of a government vehicle in a hospital parking lot at 1 in the morning, two medical professionals from entirely different worlds, finding the same language immediately because the language of keeping someone alive is universal and does not require lengthy introductions. Garrett stood outside the vehicle and watched the street. He didn't pace, he barely moved. But Maya, glancing up once through the rear window, saw the set of his shoulders and understood that everything still and controlled in Garrett Stone was costing him something significant. This was his brother. Whatever operational discipline said he was supposed to feel, right now what he actually felt was leaking through in the tightness of his jaw and the way his eyes went to the vehicle window every 30 seconds. Daniel's monitor alarmed. Not a catastrophic alarm, not the flatline shriek of cardiac arrest. A rhythm alarm. The heart rate had dropped suddenly to 44, and the waveform on the portable screen had changed shape in a way that made both Maya and Mercer reach for things simultaneously. PVC cluster, Maya said. I see it. Mercer already had atropine drawn. Hold on the atropine, let me look at this. She studied the waveform for 10 seconds that felt considerably longer than 10 seconds. The clusters came in pairs, two abnormal beats, a pause, normal rhythm, two more, a pattern. Patterns meant something. This is the toxin affecting the cardiac conduction system. If we push atropine and the rate jumps, we could trigger a different arrhythmia. His QT interval is already prolonged. I want to try a lidocaine bolus first. Mercer looked at her. A professional assessment. Then your patient. 2 milligrams per kilogram. Slow push. She administered it herself. She watched the monitor. 10 seconds. 20. The cluster pattern stuttered 2 more pairs and then, like a faulty electrical connection finally finding its ground smoothed, heart rate climbed back to 63. The waveform normalized. Mercer let out a breath. Nice call. We're not done, Maya said. That's going to happen again. Possibly worse. How far are we from wherever you're taking him? 40 minutes. She looked at Daniel Stone's face. In repose with the pallor and the bruising and the evidence of everything his body had survived, she could see the resemblance to Garrett, the same bone structure, the same quality of endurance built into the physical form. Brothers, one standing outside watching the night, one fighting a battle entirely on the inside, unaware of any of it. Then we'd better talk about what happens when we get there, she said. Because 40 minutes from now, this is going to get worse before it gets better. Garrett had opened the rear door. He had heard the alarm. He stood there with his hand on the door frame and his eyes on his brother's face, and for just a moment, there was no major, no special forces, no federal document or operational authority, just a man who needed his brother to be okay, and who was trying very hard not to let that need interfere with his judgment. He's stable, Maya said before Garrett could ask. For now, get in front. We need to move. The drive took 38 minutes. Maya monitored. Mercer watched. Daniel's rhythm held with 2 more minor events that she managed without drama, each one confirming the pattern, each one telling her more about what the toxin was doing and how fast they needed to get ahead of it. She talked through it as she worked, not for Mercer's benefit. Specifically, he was competent in following, But because she had always processed out loud in high-stakes situations, always found that articulating the problem clarified it, that the act of putting words to what she was seeing forced her to see it more completely. The compound is hitting three systems simultaneously, she said. Hepatic, hematologic, cardiac. The liver damage is slowing its own clearance. The coagulation disruption means any secondary bleeding from the surgical repair could be slower to resolve than normal. And the cardiac conduction effects are going to be the most immediately dangerous because they're going to escalate as the toxin concentration peak, which based on the timeline Mercer gave me, 10 days since administration puts us right at the peak window. Tonight is the worst night. And if we get through tonight, Mercer asked, then the concentration starts to decline on its own as long as the chelation is keeping up. The liver recovers, the coagulation normalizes. But, she paused, that assumes nothing else is introduced. Mercer went still. You think there could be a second dose? I think someone engineered a compound specifically to be administered over time. I think they put it in a man they then told his own military was dead. And I think the reason they wanted him alive and compromised, rather than simply dead, is because there is something he knows, or something he can do, or something he is that is useful to someone, and that someone has had 10 days to plan for the possibility that he might be found. She looked at Mercer steadily. So yes, I think we need to operate on the assumption that someone might try to finish what they started. The vehicle slowed. They had arrived somewhere Maya didn't know where specifically, a secure facility of some kind, the details of which Garrett had not shared and which she had not asked about, because she understood implicitly that there were things she was being trusted with and things that were not hers to know, and she respected that line. The rear doors opened. A team was waiting, 3 people, 2 with medical credentials visible, 1 who was clearly security. They moved efficiently and without wasted motion the way people move when they have rehearsed for contingencies like this. Inside, wherever inside was, Daniel was transferred to a proper bed in a proper medical setup. Not a hospital exactly, but close enough that Maya could work. Real monitors, a crash cart, a lab terminal that Mercer connected to remotely and that began pulling Daniel's portable readings immediately into whatever system was on the other end. Maya stood at the bedside and conducted a full reassessment, head to toe, the way you do it when you want to know everything and not just the thing you were already looking at. She checked his abdomen. The surgical incisions were intact, no signs of rebleeding externally, which was reassuring, but not conclusive. She checked his reflexes. She checked his pupils. She checked his extremities for color, temperature, perfusion. She was thorough and she was fast, and when she straightened up, she had a complete picture of Daniel Stone's status in her mind that was clearer and more accurate than anything she could have written down. He needs to wake up, she said. Mercer looked up from the lab terminal. You want to reverse the sedation? Not fully. I want to bring him up enough to assess his neurological status. If the toxin has crossed the blood-brain barrier and given the hepatic compromise, I think it may have. We need to know now, not in 6 hours. She paused. And I think Garrett needs to talk to him. Maya. Garrett's voice came from the doorway. He had been standing there, she wasn't sure for how long. Are you sure that's medically sound? Medically, it carries a risk, but your brother was deliberately kept alive by people who want something from him. If there is information inside his head that explains what that is, information that might also explain what they're going to try next, and he is capable of communicating that information right now, then the medical risk of bringing him up is smaller than the operational risk of waiting. Garrett was quiet for a moment. Then he walked to the bedside and stood across from Maya and looked at his brother with an expression that she thought she might remember for a long time. Do it carefully, he said. That's the only way I do anything. It took 11 minutes to bring Daniel Stone's sedation level down to the threshold where consciousness became possible. Maya watched the monitors. She watched his face. She was aware of Garrett standing very still across from her, aware of Mercer at the lab terminal, aware of the quiet in the room that was the particular quiet of people waiting for something that mattered enormously. Daniel's eyes opened. Not all at once, it was a gradual process, the way waking from deep sedation always is the body negotiating between the pull of chemical unconsciousness and the insistence of the world. His eyes opened, found the ceiling moved, found Maya's face, found Garrett's. Garrett, his voice was barely audible, rough and broken and absolutely certain. I'm here. Garrett's voice did something at those 2 words compressed, controlled a man holding the full weight of 2 weeks of believing his brother was dead into a single steady tone. I've got you. You're safe. Daniel's eyes closed again, opened. The effort was visible on his face. They said you were dead, that the mission was, we were told the same about you, Garrett said. You've been missing for 12 days. Daniel absorbed that. Maya watched his vitals, heart rate climbing slightly with the rise in consciousness, manageable, not alarming. The compound, he said, his voice steadied fractionally. Oris, his name is Oris. He's inside. Garrett, he's inside the program. A pause, his hand moved, reached Maya realized toward his brother, an involuntary gesture, the gesture of a man reaching for something real after 2 weeks of nothing real. Garrett took his hand, held it, said nothing. Daniel. Maya leaned into his line of sight. I'm Dr. Reeves. I treated you tonight. I need you to stay with me for another few minutes, okay? Can you do that? He focused on her face with visible effort. You fixed my chest. I did. You had internal bleeding and a collapsed lung. You're through the worst of the surgery, but you were also given a compound, a toxin. We're treating it. Do you know when it was administered? 3 days before the mission. They told me it was. He coughed and Maya's hand went to his chart, reflexively checking, watching. The cough resolved. They said it was a vaccination protocol, standard for the region. I didn't question it. Something crossed his face at that admission. Not shame exactly, but the rawness of someone who has had considerable time alone and compromised and unable to do anything about it to review every decision that led to where he ended up. You couldn't have known, Maya said. This compound was specifically engineered. It's not something routine testing would have caught. Oris had access to the medical protocol, Daniel said, and his voice gained a thread of urgency that pushed against the sedation and the exhaustion and everything his body was trying to do at once. Garrett, he approved the pre-mission vaccinations. He's been running assets inside for I don't know how long. He tried to. When I figured it out, that's when the explosion happened. Someone set that charge. It wasn't an accident. Garrett's hand tightened on his brother's. His face did not change in any way that a stranger would have noticed. But Maya was watching, and she saw it the way a piece of information settled into Garrett Stone with a particular weight of something that confirmed what he had already feared, and that now required him to decide in the next few minutes what he was going to do about it. Oris, Garrett said. Thomas Oris. Daniel's eyes held his. You already suspected him. I had questions, Garrett said. Now I have answers. He looked up, looked at Hobbs, who had been in the corner the entire time with the tablet, and Hobbs gave him a single nod that communicated something specific, something that was clearly the conclusion of a calculation they had been running before this moment. Get Colonel Hartman on a secure line, Garrett said. Now. Hobbs was already moving. Daniel's eyes went back to Maya. He was fading again. Consciousness was expensive, and he was running on empty, but he focused on her with a kind of deliberate attention that felt important. You were fired, he said, for treating me. She met his eyes. Yes, I'm sorry. Don't be, she said. It was the right call. It's always the right call. He almost smiled. It was exhausted and barely there, and it was, she thought, the most genuine expression she had seen on a human face in a very long time. Then his eyes closed, and this time they stayed closed, because his body had gotten what it needed from those 12 minutes of consciousness and was now firmly, insistently pulling him back under, where it could do the work of repairing itself without the additional cost of awareness. Maya looked at his monitor. Heart rate 67, pressure holding. The arrhythmia that had frightened her in the vehicle had not recurred in the last 22 minutes. She allowed herself quietly and internally one small measure of relief. Then her phone buzzed. She looked at the screen. A number she didn't recognize. Different from Garrett's number. She picked it up because she had learned tonight that unknown numbers in the middle of the night were never nothing. Hello? The voice on the other end was male smooth and carried the particular quality of someone who had rehearsed what they were about to say. Dr. Reeves, I understand you've had quite a difficult evening, fired from your hospital, drawn into a situation that has nothing to do with you. I want you to know that I have a great deal of respect for what you do. A pause. My name is not important. What's important is that I'm offering you a way out of something that is going to get significantly more dangerous. Leave the facility you're in. Go home. Whatever you've seen tonight, whatever Mr. Stone may have told you, I want you to understand that you are a surgeon, not an intelligence operative, and the people involved in this matter operate by rules that are very different from the ones you are accustomed to. She was quiet. She looked at Garrett, who had heard her tone shift and was already moving toward her. She held up one finger. Give me a moment, and spoke into the phone with deliberate steadiness. How did you get this number? The same way we got to Mr. Stone the first time, the voice said. We're very good at finding people, Dr. Reeves. That's the point I'm making. You have done something remarkable tonight. No one disputes that. But you are now in possession of information that makes you a problem for people who do not like problems. Another pause, and now the pleasantness in the voice had a thin, cold quality beneath it, like ice with something moving underneath. Go home, while that is still a choice available to you. The call ended. Maya lowered the phone. Garrett was in front of her. He had read everything he needed to from her face before she said a word. Who was that? Someone who knows where we are, she said. The room went very quiet. Garrett turned to his operators without hesitation. Lock it down. Nobody in or out without my authorization. He turned back to Maya, and what was in his face now was not the faith she had seen earlier or the raw grief of a brother standing over a brother. It was something older and harder and entirely focused. They've tracked you. They've tracked us, she said, or this location, or both. She looked at Daniel's monitor, still stable, still holding, and felt the weight of what the voice on the phone had said pressing against her chest. She was a surgeon, not an intelligence operative. Rules very different from the ones she was accustomed to. All of that was true. All of that was entirely accurate. She was 41 years old and she had been fired from her job 6 hours ago, and she was standing in an undisclosed location in the middle of the night because a man she saved had turned out to be the thread connecting to something much larger than a night shift in a trauma bay. She thought about going home. She genuinely considered it for approximately 4 seconds with the full seriousness it deserved. Then she looked at Daniel Stone's monitor, at the chelation drip she had calculated, at the cardiac protocol she had established that was right now the thing standing between this man and another arrhythmia that the next time might not resolve with a lidocaine bolus. "I'm not going anywhere," she said, not to Garrett, not to the room, just to herself, which was where every real decision she had ever made had been made first. Garrett looked at her for a long moment. Then he nodded. Once. The nod of a man who had just confirmed something he had already decided he believed. "Then we need to talk about what comes next," he said, "because whoever that was, they're not calling to negotiate." Garrett Stone did not waste time on explanations that didn't move the situation forward. That was the first thing Maya had learned about him in the hours since he had walked into a recovery room at Harbor Heights and reduced Victor Ashford to silence with 3 sentences. He processed, he decided, he moved. Right now, he was moving fast, and everyone in the room was moving with him. "Hobbs," he said, "where are we on Hartman?" "Secure line in 4 minutes," Hobbs said from the corner fingers already working. "He's been briefed on Oris. Colonel wants confirmation from Daniel directly before he moves." "Daniel is not in a position to give confirmation directly. He gave it to me. That's going to have to be enough." Garrett looked at the 2 operators he had positioned at the facility's entry points. A look passed between them, the kind of wordless communication that comes from years of working in close proximity under high-stakes conditions, and both men adjusted their positions without being told specifically how. Maya was at Daniel's bedside watching the monitor adjusting the drip rate on the chelation line by a fraction that Mercer noted and approved with a silent nod. She was listening to all of it. She was filing all of it. The name Oris. The phrase inside the program. The fact that Garrett had said he already had questions before Daniel confirmed them, which meant this investigation, whatever it was, had been running before tonight, before Daniel was found, before any of this collided with a trauma bay on a cold evening and a surgeon who refused to walk away from a dying man. "They called me," she said, not turning from the monitor. "Not you, not this facility directly, me." She let that sit for a moment, which means they were tracking me specifically, not just the location. Garrett came to stand beside her. "Since when?" "I don't know, since I left the hospital, since I met you at the diner." She turned to look at him. "Or since before that, since I operated on Daniel." She watched Garrett's jaw tighten. If they had someone at Harbor Heights, someone who knew Daniel had been brought in and flagged it, then they would have known I was his surgeon before you did. They would have had hours. "The phone call Ashford received," Garrett said almost to himself. "We pulled the number. It traces to a shell, but the routing Hobbs pulled the Ashford call routing again." Hobbs was already on it, cross-referencing now. "If the same network made both calls," Maya said, "then whoever is running this was monitoring Harbor Heights from the moment Daniel came through those doors. They didn't try to stop the surgery. They let me save him." She heard herself say it and felt it land with full weight. They needed him alive too, just not conscious, not talking. "He's more useful as leverage than as a body," Garrett said. "Dead, he's a closed file. Alive and compromised, he's a hold on everyone who cares whether he stays alive." His voice was carefully level. She understood now that this was how Garrett Stone carried the things that were most personal to him, not by separating emotion from analysis, but by running them through the same channels simultaneously, letting one inform the other without either one overtaking. "Routing confirmed," Hobbs said. "Same network, different node, but same infrastructure. Whoever called Dr. Reeves tonight is connected to whoever called Ashford." "So Ashford knew," Maya said. "Ashford was used," Garrett said. "There's a difference, Gistan. He was a convenient mechanism, one with administrative access and financial motivation, who could be handed a reason to erase a patient's records without fully understanding why. He may not know what he's actually connected to." A pause. "That doesn't make him less culpable, but it changes how we handle him." Garrett, Maya's hand went to the monitor. Daniel's heart rate had ticked up 78, 81, 84. Not an arrhythmia, not yet, but trending in a direction she didn't like. "He's climbing." Mercer was already moving. Sympathetic response to the sedation lightning. "We could push the level back down." "No," Maya watched the waveform. "Look at the T-wave morphology. That's not just a sedation response. That's the toxin. She made a decision in the space of 3 seconds. I need to start him on a continuous lidocaine infusion. Mercer, the protocol I drafted in the vehicle, the drip rate I calculated for 68 kilograms. I have it. Run it. If the rate doesn't stabilize his rhythm in the next 6 minutes, we're going to need to talk about a different approach. She leaned closer to Daniel's face. Stay with me, she said quietly to him, specifically to the part of him that was somewhere between sedation and consciousness, and fighting a battle in his own blood that he couldn't see or control. You already survived 12 days of this. You can give me 6 more minutes. Mercer ran the infusion. The room held its breath, which was not a metaphorical description. It was a literal one, the way breathing in a room actually changes when everyone in it is watching the same number on the same screen and willing it to do a specific thing. 87, 86, a pause that lasted 4 seconds and felt like a month. 83, 80, 76. Maya let out a slow breath. Good, she said. That's good. Nice protocol, Mercer said. I've been doing this a long time, she said. She meant it simply without pride as a statement of fact. She had been doing this for a long time, and she was good at it, and right now being good at it was the most important thing she could contribute to whatever this night was becoming. Hobbs stood up abruptly. The change in his posture was enough to pull Garrett's attention before Hobbs said a word. We have movement, Hobbs said. Southeast perimeter. 2 vehicles, no lights approaching from the access road. Every operator in the room adjusted simultaneously. It was not a chaotic adjustment. There was no running, no shouting, no visible panic. It was a systematic reconfiguration of positions that happened with the quiet precision of people who had trained for exactly this kind of moment and had reached the point where training and instinct were indistinguishable from each other. Maya did not move from Daniel's bedside. She was acutely physically aware of the fact that she was the least trained person in this room for what was potentially about to happen, and she was equally aware that her presence at this bedside was not optional. The lidocaine infusion was running. The chelation was running. If either line was disrupted, or if the monitoring was interrupted and nobody was watching his rhythm, she stayed. How long? Garrett asked. 3 minutes to the outer perimeter. 7 to this position, Hobbs said. Hartman, Garrett said. Still 2 minutes out on the secure line. Then we're not waiting for Hartman. Garrett looked at his operators, one look that distributed a set of instructions Maya could not read, but that they clearly could because both men moved with immediate purpose. Then he looked at Maya. You and Mercer stay with him. Do not move from this room, regardless of what you hear. The door is solid core and it locks from the inside. Lock it the moment I step out. Garrett, Dr. Reeves. He said her name the way she had heard attendings say things to residents in crisis moments, not unkind, entirely firm. I need you to be exactly where you are and do exactly what you're doing. That is the job. Can you do that? She met his eyes. Yes. Lock the door. He went out. She locked it. The sound of the bolt was louder than it should have been in the quiet of the room. Mercer looked at her across Daniel's bed. He was a calm man. She had established that about him in the first 10 minutes. The kind of calm that comes from having been in situations where panic was not a useful option enough times that the instinct had been largely trained out. His rhythm is stable, Mercer said, a fact offered as an anchor. Yes, she said, it is. She checked the infusion rate. She checked the chelation. She did the things she could do, and she did not think about what was happening outside that door, which was a discipline she was familiar with from surgery, the ability to compress her awareness to the dimensions of what was immediately in front of her and to trust that the things outside her field of control were being handled by the people whose job it was to handle them. Daniel's eyes opened again. Not the cautious, slow ascent from sedation this time. He came up faster with more awareness, and his eyes found Maya's face before they found anything else in the room. She saw him process where he was, the monitor, the lines her face with a speed that surprised her. Whatever the toxin had done to his body, his mind was fighting back. Movement outside, he said, not a question. Don't worry about that. I'm a SEAL, Dr. Reeves. I can hear body weight shifting through a locked door. His voice was rough but functional. He tried to sit up, and Maya put one hand on his chest, gentle, firm, the gesture of someone who has stopped post-op patients from moving since her residency and has a reliable technique. You have a splenic repair and a liver contusion and a lidocaine infusion running into your arm, she said. You are not sitting up. He held still. Not because he couldn't move, she got the distinct impression he could have if he chose to, but because he had made a rapid assessment of the same situation she had and reached the same conclusion, which was that his body was not currently the asset he was accustomed to having available. What's Garrett doing? His job, like I'm doing mine. Daniel looked at the ceiling. His jaw was tight. She recognized the particular frustration of a physically capable person who was temporarily unable to be physically capable and who found this deeply personally offensive. Tell me what you know about the compound, he said. About what it's doing. She told him. Not a summary, a real explanation, the kind she would give a colleague because he had asked a real question and he deserved a real answer. And frankly, she thought knowing the truth about what was happening in his own body was likely better for him than the alternative. He listened without interrupting, with the focused attention of someone processing tactical information. When she finished, he was quiet for a moment. "The person who made that compound," he said, "that's Oris's signature. Modified organophosphates slow release. There were two other cases, operatives in different theaters. Both died within 2 weeks of exposure. They were listed as natural causes." Maya stared at him. "How many people has he done this to?" "That we know of, 3, including me. That we don't know of." He left it there. The implication was heavy enough without completing the sentence. 3 rapid concussions, not gunshots. Something else, a non-lethal deterrent of some kind, came from somewhere outside and above. Then silence. Then the sound of voices, brief and controlled, and then nothing. Maya realized she was holding her breath. She made herself stop. Mercer, to his credit, did not move and did not change expression. He kept his eyes on the monitor. It was, she thought, possibly the most professional thing she had witnessed all night, and the night had contained a significant number of professionally impressive moments. Her phone buzzed. "Garrett." She answered it immediately. "Talk to me." "Two-person advance team. They're secured. The vehicles pulled back when the perimeter held." A pause. "They were not here to extract. They were here to confirm the location. We have maybe 30 minutes before whoever sent them decides on a different approach. Then we need to move him again." "That's not possible. His condition?" "I know his condition," she said. "I'm managing his condition in real time. And I'm telling you that moving him again carries significant risk. But staying here carries a certainty." She looked at Daniel, who was watching her with clear eyes and an expression of someone who was already making his own calculations. "What's the alternative?" "Colonel Hartman is authorizing a full extraction team. They're 40 minutes out. I need to hold this location for 40 minutes. 40 minutes. She looked at the monitor. She looked at the infusion. She did the math on the chelation protocol and on the lidocaine and on what she would need to do in the next 40 minutes to keep Daniel Stone's cardiac rhythm from doing something that 40 minutes of military extraction protocol would not be able to fix. 40 minutes, she said. "I can do 40 minutes. "I know you can," Garrett said. And the certainty in his voice, not reassurance, not encouragement, actual certainty, the kind that comes from watching someone perform under pressure and drawing a conclusion based on evidence, did something to the inside of her chest that she filed away to think about later when there was time for things like that. She hung up. She looked at Mercer. "We're holding for 40 minutes. I want vitals every 5. If that rhythm shifts by more than 10% from current baseline, I want to know before the machine alarms." "Understood. And I need you to talk me through what Oris's other 2 cases look like at peak toxin concentration. If there's a pattern in how this compound peaks and what it does to the cardiac cycle at maximum concentration, I want to know it before we get there." Mercer nodded slowly. "The first case operative, named Callahan, died in country 14 days post-exposure. The attending physician noted a sudden onset, prolonged QT event approximately 72 hours before death. No identified cause. Attributed to stress, cardiomyopathy." 72 hours before death, Maya repeated, and Daniel is 10 days out from exposure, which puts the peak concentration window. "Right now," she said. "Tonight. The next several hours." She looked at Daniel. "I already knew that. I just wanted to know if Callahan's presentation matches what I'm seeing." "It does." "Then I know what's coming," she said, "and I know how to manage it." She pulled a stool close to the bedside and sat down because she was going to be here for 40 minutes and possibly longer, and she had learned a very long time ago that a surgeon who exhausted herself standing when she could sit was a surgeon who made mistakes when it mattered most. "Talk to me, Daniel. Tell me about Oris. Not for the operation, for you. Talking keeps your autonomic nervous system engaged. It'll help with the rhythm." Daniel looked at her for a moment with an expression that was not quite surprise and not quite amusement, but somewhere in between, the look of a man who has had a lot of people ask him to do a lot of things, but who has not recently been asked to talk about a federal intelligence case as a cardiac stabilization strategy. "That's real medicine. Everything I say is real medicine," she said. So he talked. He talked about Oris and not operational details, those he kept in the careful compartment that training had built for them, but about the moment he realized something was wrong. About the vaccination injection that had felt routine and hadn't been. About the way he had spent the first 3 days after the explosion, not knowing if he was dying or just injured, hiding in a series of locations he chose by instinct, when his rational mind was too compromised by the toxin to be fully operational. About the cold and the hunger and the particular horror of a body that won't do what it's told. He talked in the measured, unemotional tone of someone who is accustomed to reporting facts and who has not yet had the distance to feel the full weight of the facts he is reporting. Maya listened. She watched the monitor. She made 2 minor adjustments to his infusion during the conversation, each one deliberate, each one keeping his numbers in the corridor she needed them in. The rhythm held. 71, 73, 70, holding. 20 minutes and her phone rang again. Not Garrett's number, a number she recognized, this time Harbor Heights. She looked at the screen for a long moment, then she answered. Dr. Reeves. It was Sandra Cole, the HR director who had not looked at her during her termination, who had read the prepared language from the open folder and kept her eyes down. Her voice now was different, tighter compressed with something that Maya after a moment identified as fear. I need to speak with you. Sandra, I need to tell you something about tonight, about the call Mr. Ashford received. A pause, the sound of breathing, someone who has made a decision and is pushing themselves through the door end of it. I was in his office when it came in. I wasn't supposed to be. I had gone in to leave a document for morning. He didn't see me. The caller, whoever it was, they didn't just ask him to erase the patient record. They told him to make sure the surgeon who performed the operation didn't have any documentation of what she saw intraoperatively. They used the word eliminate. They said to eliminate the surgical record and the surgeon's notes. Another pause. I don't think they meant the paperwork, Dr. Reeves. The room felt very close suddenly. Sandra, Maya said carefully, where are you right now? I'm in my car. I left the hospital an hour ago. I drove. I don't know. I just drove. I didn't know who else to call. Are you safe right now in this moment? I think so. I'm parked at an all-night pharmacy on Clement Street. There's no one near me. Maya looked at Mercer. He had heard enough of the conversation from her side to understand the shape of it. She stood up from the stool. Sandra, I need you to stay exactly where you are. I'm going to give you a phone number. You are going to call it and tell the man who answers exactly what you told me. His name is Major Stone. You can trust him. Do you understand? A shaky exhale. Yes. Maya relayed Garrett's number. She stayed on the line with Sandra for another 45 seconds until Sandra confirmed she had written it down, and then she ended the call and immediately called Garrett. They threatened Sandra Cole, she said before he could speak. Ashford's HR director. She overheard the call. The word they used was eliminate, and she doesn't think they meant documents. She heard her own voice delivering this information with a clinical flatness that she was choosing deliberately because the alternative, letting herself fully process what eliminate meant in this context in relation to herself, was not something she could afford to do right now. She's going to call you. She's a witness, Garrett. She's at an all-night pharmacy on Clement Street, and she is not protected. I'm sending someone now, Garrett said. The speed of his response told her he had understood everything she had not said, as well as everything she had. Maya, a brief pause. This is bigger than I briefed you for. I want you to know that. I want to be straight with you about that. I know, she said. You could still, Garrett. She said his name the way he had said hers earlier, not unkind, entirely firm. Don't? He didn't. 20 minutes to the extraction team, him, he said instead. Hold the line. She sat back down. She looked at Daniel, who had been watching her with clear, alert eyes throughout both phone calls, and who said nothing when she put the phone down because he was a man who understood the value of silence at the right moment. They're trying to erase everything connected to tonight, she said. Not specifically to Daniel, not specifically to Mercer, to the room, to the record of what was happening that existed only in the memories of the people in it. The surgery, my notes, Sandra's testimony. You. She looked at Daniel directly. The only way this ends is if the people who know what happened are too visible to disappear. Daniel held her gaze. Then we make noise, he said. We make a lot of noise, she agreed. His monitor showed 72 beats per minute. The lidocaine infusion was running clean. The chelation protocol was holding. She had 17 minutes before the extraction team arrived, a witnessed account from Sandra Cole that connected Ashford to a network that had used the word eliminate a patient who was awake and coherent and in possession of testimony that could dismantle whatever Thomas Orris had built inside the program. And somewhere outside this room, Victor Ashford was sitting in a hospital he ran and discovering slowly that the thing he had done tonight, the casual, profit-motivated act of firing a surgeon and ordering her escorted from the building, had pulled a thread that was attached to something so much larger than his donor lists and his bottom line that it was going to unravel everything he had spent his career building. Maya Reeves looked at the monitor. She looked at her patient. She had been fired 8 hours ago. She had been threatened an hour ago. She had driven through the middle of the night and talked a military officer through a cardiac stabilization protocol in the back of a government vehicle and locked herself in a room with a Navy SEAL who had survived 12 days of deliberate poisoning on will alone. She was exhausted. She was still entirely here. 17 minutes. The extraction team arrived in 16 minutes, not 17. Maya heard them before she saw them. The particular organized sound of multiple people moving with unified purpose, the kind of coordinated entry that announced itself not through noise, but through the sudden change in the quality of the silence around it. The door unlocked from outside. Garrett's voice came through first, and then the room expanded with 4 additional people who moved to positions with the efficiency of a mechanism clicking into place. Daniel's monitor showed 70 beats per minute. The lidocaine infusion was clean. The chelation had been running for over an hour. Maya stood up from the stool and gave the lead medical operator, a woman who introduced herself only as Torres, with the rapid handshake of someone for whom pleasantries were a tool rather than a habit, a full verbal report in under 2 minutes. Toxin profile, cardiac protocol, chelation rate, what to watch for, what it meant if she saw it. Torres listened without interrupting and absorbed it with the focused competence of someone who would not need to be told twice. I've got him. Torres said. The lidocaine drip cannot be interrupted, Maya said. Not for transport, not for anything. If that line goes down for more than 4 minutes, his rhythm will destabilize. Understood. And the chelation, Dr. Reeves, Torres met her eyes with a directness that was not dismissive, exactly the opposite. I've read your protocol. It's good work. I've got him. Maya stepped back. She did it deliberately, consciously, the way you make yourself release something you have been holding for a long time. Not because you want to let go, but because the holding has become the thing that prevents the next necessary action. She had been keeping Daniel Stone alive for the last 4 hours on the materials available to her. Now there were better materials in better hands, and the next necessary action was something different. Garrett was at her elbow. We need to talk. We need to talk, she agreed. They went into the adjacent room, which was smaller and had no medical equipment and no monitor screens and no specific purpose that she could identify other than being a place where people went to have conversations they didn't want overheard. Garrett closed the door. He looked at her with the expression she had come to recognize as his default assessment mode, thorough, rapid conclusions drawn and immediately held up against new information. Sandra Cole is safe, he said. My contact reached her at the pharmacy. She's being relocated tonight. Her testimony is being recorded as of 40 minutes ago. Good. She confirmed everything she heard. The caller to Ashford used specific language about you specifically. We have the call recording from Ashford's office. There's a system that logs administrative calls that Ashford apparently didn't know the IT department had reinstated after a security audit last year. He paused. The caller is Thomas Orris. The name landed in the room with full weight. Orris called Ashford directly from a number that traces back to a shell, but the voice print is being matched now against recordings we have from program briefings. Hartman's team is running it. We should have confirmation within the hour. Garrett's jaw was tight. He called Ashford because Ashford was the fastest mechanism available to him for erasing Daniel's trail from the hospital. He didn't expect Sandra to be in the office. He didn't expect you to already be gone. And he did not expect a pause. He did not expect that you had already spoken to Daniel. What does Daniel know that makes Orris desperate enough to call a hospital CEO in the middle of the night? She asked. She bowed. Not because she didn't have a working theory she did, but because she wanted to hear Garrett's version and see where it matched hers. Daniel identified the mechanism, Garrett said. Not just Orris personally, the full mechanism. There are 3 other active operatives in the program who were given the same modified vaccination protocol in the last 18 months. They don't know. Their commands don't know. Orris has been building a leverage structure, assets who are unknowingly compromised, who can be activated at any point, incapacitated or eliminated on a timeline of his choosing. It's not just what Daniel knows about Orris. It's that Daniel is the only person outside Orris's network who has seen the full picture and survived long enough to talk. Maya processed that. 3 other operatives, unknowingly carrying the same compound in their blood that had been burning through Daniel's system for 10 days. 3 people who were right now in this moment living their lives with a slow clock running inside them that they couldn't see or feel. They need to be tested, she said immediately. Identified and tested. If the compound is the same formulation and the administration window is similar, the hepatic and hematologic markers should be detectable in standard blood work if you know what you're looking for. That's what Hartman is pushing for authorization on right now. I can give you the specific panel. The markers are not flagged as abnormal in a routine screen. You have to know to look for the enzyme ratio, the specific coagulation pattern. Give me 30 minutes with a computer and I'll write the diagnostic criteria. Garrett looked at her with that same expression, the one she kept not having an adequate name for, the one that sat between respect and something more personal than respect, something that had been building across 8 hours of watching her make decisions under conditions that would have broken a different person. I was going to ask you to do that, he said. I know, she said. He almost smiled. It was brief. There's something else. Hartman has requested your formal participation in the medical investigation, not as a consultant, as the lead medical analyst. The diagnostic criteria you just described, the protocol you built tonight, the intraoperative findings from Daniel's surgery, all of it is going to be central to building the case against Doris. Hartman wants you on record on the team with full federal witness protection status until the case is closed. She heard every word of that. She heard the part that was an opportunity, and she heard the part that was a threat assessment delivered in professional language. Federal witness protection. Until the case is closed. How long? She asked. We don't know yet. Oris has had 18 months to build this. Dismantling it takes as long as it takes. She nodded once. All right. Maya. He used her first name. He had used it a handful of times across the night, and each time it had carried a different weight. This time it was deliberate, not tactical, not briefing language. Something personal that he had decided to let be personal. I want to be honest with you about something. You were in danger tonight. You are probably still in some degree of danger until Oris is in custody. I pulled you into this, and I want you to understand that I understand the full cost of what that means. You didn't pull me in, she said. I was already in it the moment I decided to treat Daniel instead of walking past him. She looked at Garrett steadily. Victor Ashford thought he was firing a surgeon who made a bad financial decision for the hospital. What he actually did was ensure that the one person who had seen inside his brother's chest and knew exactly what was wrong with him was free to leave the building, get a phone call, and drive to a diner on Merchant Street without anyone from Harbor Heights being able to track her movements. She paused. He fired me because I did the right thing, and doing the right thing turned out to be the only thing that kept Daniel alive. That's not your fault. That's how it works when people make choices. Garrett was quiet for a moment. Then, you should know that what happens to Harbor Heights to Ashford, that's not going to be nothing. The federal involvement tonight, Sandra's testimony, the call recording the hospital's board is going to receive a report that none of them are going to enjoy reading. That's not why I did any of this, she said. I know it isn't, he said, but it's still going to happen. She thought about the marble lobby, the donor wall 3 floors high, the way Victor Ashford had gestured toward the hallway with one hand like a man directing someone to a lesser table. She thought about the man under the Route 9 overpass who had none of those things, who was a John Doe with no insurance and no record, who had cost the hospital money they couldn't recover, and who had turned out to be a Navy SEAL with 12 days of intelligence in his head that was going to matter enormously to a great number of people. She thought about the word triage, the most basic principle she had ever been taught. You treat the one who needs it most. You do not treat the one who can pay the most. The first time she had ever been taught that, she had thought it was obvious. She had spent 15 years learning that in the real world it was anything but. I need to check on Daniel, she said. Torres stepped back when Maya came to the bedside, a professional deference that Maya acknowledged with a brief nod. Daniel was awake again, more fully awake than before the sedation having metabolized further, his eyes open and tracking with the clarity of a mind that was coming back to itself after a long, forced absence. His color was better. Not good, not anywhere near good, but better. The gray-white of intraoperative crisis was gone, and in its place was the pale exhaustion of someone who was genuinely and truly on the other side of the worst of it. He looked at Maya when she came to stand at his bedside, and he said, "You're still here. I told you I wasn't going anywhere." Yeah, he looked at the ceiling for a moment. I believed you. I don't know why. I'd known you for about 6 minutes. 8, she said. You were awake for 8 minutes before you went back under. 8 minutes. He almost laughed. Almost the ribs caught it. She saw him absorb the pain and redirect around it with the particular economy of someone who had extensive practice with exactly that maneuver. My heart rate was doing something earlier. It was. I managed it. I know. I could feel it settling, rather, when the rhythm came back. It's a strange thing to be aware of. He was quiet for a moment. Then, Garrett told me about Sandra Cole. She did the right thing. People keep doing the right thing tonight, Daniel said, against significant odds and with significant personal cost. His eyes came back to her face. They were the same dark color as Garrett's, but they held something different in them, not the controlled, analytical quality of a commander, but something more interior, more reflective. The look of a man who had had 12 days alone with his own thoughts and who had come out of it with some things clarified that he had not been clear about before. My brother told me what you said, about Ashford firing you and about how it turned out to be the thing that made everything possible, the way you looked at it. I meant it. I know, that's what I wanted to tell you. He held her gaze with a steadiness that cost him something. She could see the effort it took in his current condition just to maintain that level of focus. I spent 12 days under a bridge telling myself that if I made it out, I was going to stop waiting to say the things I meant. So, he paused. Thank you, not the kind of thank you you say because you're supposed to, the kind you say because someone reached into a situation where you were invisible and they made you real again. You did that. Before you knew who I was, before any of this, you made me real again. Maya had been talked to in many ways by many patients over 15 years. She had been thanked, and she had been yelled at, and she had been cried on, and she had been largely ignored by people who were too sick or too scared to be aware of her as a person rather than a function. She had never had a patient say anything that landed quite like that. She did not respond immediately because the immediate response would have been insufficient. She let it sit. She let it be what it was. Your job, she said finally, is to rest and to let the chelation do what I designed it to do, and to be alive and coherent enough in the next several days to tell the people who need to hear it everything you told us tonight. That's what you owe me, not thanks. That. Deal, he said, and this time the almost laugh made it all the way to his eyes. His monitor showed 68 beats per minute. Steady, clean. The waveform on the screen was the most normal looking it had been since she first saw it in the recovery room at Harbor Heights, and she felt the deep, specific satisfaction of a problem that has been correctly identified and correctly addressed. Not solved recovery would take weeks, and the investigation would take longer, and there were 3 other operatives somewhere who were carrying something they didn't know about and whose situations needed to be resolved with the same urgency. But this particular battle, this particular man's heart, on this particular night, she had won it. That was real. That counted. She stepped back from the bedside. She went to the small adjacent room, and she sat down at the table that was there, and she opened the laptop that Hobbs had left for her, and she began to write the diagnostic criteria. The specific hepatic enzyme ratios, the coagulation pattern markers, the cardiac indicators, all of it written precisely clearly in the language of medicine that anyone trained to look would be able to apply to a routine blood panel and suddenly understand what they were looking at. She wrote for 40 minutes without stopping. When she was done, she read it back once, made 2 small corrections, and sent it to the address Hobbs had given her, which connected to Hartman's medical team, and from there would go to the commands of 3 operatives who were currently living without knowing what they were carrying. Garrett came in when she was sending it. He sat down across from her and looked at what was on the screen with the focused attention of a man who was not a doctor, but who had learned tonight enough to understand the significance of what he was seeing. That's everything they need, he asked. That's everything they need to identify it. Treatment is more complex and will need to be tailored individually, but this gets them to the diagnosis. Once they have the diagnosis, they can reach out and I'll consult. You'll consult, he repeated, noting the word, noting the implied commitment. I'm already in this, she said. Might as well be useful. A silence settled between them that was not uncomfortable. It was the silence of 2 people who had been through an accelerated and extreme version of getting to know each other and who had arrived at the other side of it with a clarity about one another that normally takes years. The board at Harbor Heights is convening an emergency session at 9 this morning, Garrett said. Hartman made a call. The federal involvement in tonight's events combined with Sandra's testimony and the call recording has been communicated to the board chairman. Ashford will be placed on administrative leave pending investigation before the session ends. He paused. There will be a formal offer of reinstatement extended to you by noon. Maya considered that. Will there? I worked there. You don't have to take it. I know. There are other options, he said, carefully, not pushing presenting. Hartman's offer is real and it's standing. Military medical consultant focus on special operations medicine, the diagnostic work you've already started. It's not a trauma bay, but the work matters. The work in the trauma bay matters too, she said. It does, he agreed immediately. I'm not arguing otherwise. I'm saying you have choices, some of which you didn't have yesterday. She thought about that. Yesterday she had been a trauma surgeon at Harbor Heights Medical Center with a donor wall in the lobby and a CEO who valued the donor wall more than he valued the people whose job was to keep donors healthy enough to keep writing checks. She had done her job. She had done it well. She had walked through those doors every day and made the calculations and made the calls, and she had believed in exactly the right place for exactly the right reasons. She had not been wrong about the reasons. She had been wrong about the place. I'll talk to the board, she said. Not because I want reinstatement, because there are things that need to be said in that room by someone who was there, and I am the person who was there. Garrett nodded. I'll go with you. She looked at him. You don't have to do that. I know, he said. And the echo was deliberate, and it was almost warm, and it was the closest either of them had come all night to acknowledging that what had happened between 2 strangers in the last 8 hours was something that didn't have a standard name because it didn't fit a standard category. At 9:14 in the morning, Maya Reeves walked back into Harbor Heights Medical Center for the second time in 12 hours. She was not wearing surgical scrubs. She had stopped at her apartment for 40 minutes, showered, changed, stood in her own kitchen, and drank a cup of coffee, standing up at the counter the way she always did, because she had never gotten around to buying a kitchen table. And she had looked at herself in the bathroom mirror before she left and said nothing, because there was nothing that needed to be said. She knew what she looked like. She knew what she had done. Those 2 things aligned, and that alignment was the only mirror that had ever mattered to her. Garrett Stone walked beside her through the main lobby. He was in uniform. She had not seen him in uniform before, and the effect was considerable, not because of the insignia or the bearing, but because of the way the other people in that lobby reacted to it. The deference was immediate and instinctive. The marble and the donor wall, and the particular expensive quiet of a place designed to communicate prestige remained exactly as they had always been, and none of it landed the same way when a Special Forces major in full uniform walked through it next to a woman who had been escorted out of the same building 8 hours earlier. The board chairman met them at the elevator. He was a man in his late 60s named Gerald Park, who had the look of someone who had received a significant amount of information in a very short time and who was working hard to process it without allowing the processing to be visible on his face. He extended his hand to Maya and then to Garrett, and he said with the careful deliberateness of a man choosing every word, "Dr. Reeves, thank you for coming." "Thank you for calling the session," she said. "We have a great deal to discuss." "Yes," she said, "we do." The boardroom was on the 14th floor, 3 doors down from Victor Ashford's office. Ashford himself was not present. He was, as Garrett had said, already on administrative leave, which meant he was somewhere in this building or not in it at all, and Maya found that she did not particularly care which. The board members seated around the table were 7 people she had seen in hallways and at annual staff events, and whose names she knew without having had significant direct contact with most of them. They looked at her the way people look at someone whose situation they have just learned about, in a way that makes them feel something, not guilt exactly, but the close cousin of guilt, that comes from realizing you were present in a system while something wrong happened, and you did not know and maybe should have. She sat down. Garrett sat to her left. She looked at every face at that table one by one without hurrying. Then she spoke. She spoke for 22 minutes. She did not raise her voice. She did not use language designed to make them feel worse than they needed to feel, because making people feel bad had never been the point and was not the point now. She told them what had happened. Not her version, not a version designed to favor any particular outcome, but the sequence of events exactly as they had occurred from the moment that John Doe came through the bay doors to the moment she walked back in. She told them what she had found intraoperatively. She told them about Ashford's termination decision and about the call he had received and about what that call was connected to and how Sandra Cole had been present to hear it. She told them about the federal document Garrett had produced in the recovery room. She told them what the word eliminate had meant in the context in which it was used. When she finished, the room was completely silent. The board chairman cleared his throat. "Dr. Reeves, on behalf of this board, I want to say something before you extend anything," Maya said. She said it quietly, which was more effective than saying it loudly would have been. "This hospital has the resources to be what it claims to be. The mission statement on the wall downstairs says Harbor Heights is committed to exceptional care for every patient regardless of circumstance. I have believed in that mission for 6 years. Last night a man was nearly allowed to, and I was fired because the execution of that mission conflicted with a financial relationship. That is the specific failure that needs to be addressed. Not me, not my reinstatement, the structure that made that decision possible. If you fix that structure, this is a place worth coming back to. If you don't, reinstatement is just a word." No one spoke for several seconds. Then Garrett Stone, who had not said a word during her 22 minutes, who had sat to her left in full uniform and said nothing and needed to say nothing because his presence was its own complete statement, leaned forward slightly and said, "The Department of Defense will be monitoring Harbor Heights' compliance protocols as part of the ongoing federal investigation into last night's events. We appreciate the board's cooperation." The board chairman nodded slowly. "We intend to be fully cooperative," he said, "and we intend to address every structural concern Dr. Reeves has raised, beginning today." 3 weeks later, Daniel Stone was discharged from federal medical care with a clean toxicology screen and a cardiac rhythm that his cardiologist described as textbook normal. He walked out on his own. Garrett was there. Maya was there because Garrett had called and asked if she wanted to be, and she had said yes without having to think about it. Daniel saw her across the room and crossed to her and did not shake her hand. He pulled her into a brief, careful hug, mindful of his own healing ribs, and said quietly into the space near her ear, "Still here." "Still here," she agreed. Thomas Orris was arrested 14 days after that at an airport in Frankfurt in possession of documentation connecting him to all 3 additional compromised operatives, 2 of whom had been identified and treated using Maya's diagnostic criteria. All 3 survived. The charges against Orris were federal multiple and did not include anything that would allow him to minimize or negotiate his way out of the weight of what he had done. Victor Ashford resigned from Harbor Heights Medical Center before the board could formally remove him. The investigation into his role in the events of that night remained ongoing. The hospital's new interim CEO sent Maya a letter of formal apology that ran to 4 pages and that she read once carefully and then put in a drawer. She went back to Harbor Heights. She went back because the work mattered and because the structure was being fixed and because walking away from a place that needed fixing was not something Maya Reeves was built for, and she had known that about herself for a long time. She went back and she walked through the marble lobby and past the donor wall and into the trauma bay, and she put on her gloves and she did her job the way she had always done it, the way she would always do it. Garrett called on a Thursday evening, 6 weeks after the night that had changed everything. He said he had a briefing in the city the following week and asked if she wanted to have coffee, not in a diner this time, somewhere she actually wanted to be. She said yes. She said it without hesitation and without qualification because she had learned across the longest night of her professional life that hesitation in the face of something worth doing was the one thing she refused to practice. Maya Reeves had been fired for saving a life. She had been threatened for telling the truth. She had been escorted out of her own hospital in the middle of the night by a man who was ashamed of what he was being asked to do. She had driven through a dark city toward a phone call she didn't fully understand and walked into a situation that was larger and more dangerous than anything her training had prepared her for, and she had done the only thing she knew how to do. She had shown up completely and she had done the work. She had not done it to be a symbol. She had not done it to make a point. She had done it because a man was dying and she was the person who could stop that. And every version of herself she had ever been had known without being taught that when you are the person who can stop something terrible and you choose not to, you don't get to call yourself the person you thought you were anymore. Maya Reeves knew exactly who she was. She had always known. And no one, not Victor Ashford, not Thomas Orris, not a system built to prioritize profit over people, had ever come close to changing that. That was not a small thing. It was, in the end, everything.